Hello, everyone. We are live. It's World Lupus Day. Can you even believe it? We're here. Welcome. And thank you for joining us for this special live event on World Lupus Day entitled 10 Tips on May 10th with our special guest, as you can see, our favorite rheumatologist, no other than Dr. Don Thomas, author of the Lupus Encyclopedia. My name is Kelly, and I am the creator and executive director of the Portland-based nonprofit More Than Lupus. And if you're unfamiliar with More Than Lupus, check out morethanlupus.com. We are a multi-ethnic, multi-generational, and international lupus community designed by lupus patients to connect and grow and inspire each other throughout the peaks and the valleys of our lupus journeys. And I say our because I've lived with systemic lupus and multiple lupus overlap conditions since the age of 11. So it's been 33 years, now you know my age, 33 years of navigating this illness. I want to announce something exciting. We are doing a giveaway. We are going to give away a copy of Dr. Thomas's new second edition of the Lupus Encyclopedia. For anyone who is watching this right now, you share it on your personal Facebook page, write shared in the comments, and then we'll enter you into the spin the wheel at the end to win a copy of this. It doesn't come, I was joking, it doesn't come with all these little dog tags and Post-its in it. These are my notes. You'll get a brand new copy, I promise. And I know some of you may be watching this, and because this is such a popular book in our community, may already have a copy. So your choices, if you win, are to gift a copy along to someone that you know that might need it, a friend, a family member, coworker, a loved one, or another person in the community that has lupus. Or if you so choose, I can send you a copy of My Special Butterfly, which is a children's book. So that's your choice there, but anyone who shares this, writes share it in the comments, will be entered to win. I'll be keeping track of that as Dr. Thomas is talking. So without further ado, please allow me to give a brief disclaimer, and then Dr. Thomas will take it away. So please understand that the opinions shared today are purely for informational purposes and do not replace the medical advice and or opinions of your doctor or doctors. If you're experiencing lupus or lupus nephritis or lupus overlap symptoms, it's important to follow up with your doctor and to seek the treatment that is best for you. Dr. Thomas is a qualified professional. However, he is not liable for his comments since he's not acting as your personal physician or health advocate. So here we go. Dr. T, welcome.
Thank you, and happy World Lupus Day to everybody. And just remember that knowledge is power, and by you being here and learning some new things, you'll be able to take better care of yourself and your family. So let's dive right on into 10 tips about and facts about lupus on May the 10th, World Lupus Day. So number one, you can protect your family. Lupus is a genetic disorder. We've identified over 180 genes that lead to the disorder. The more genes you inherit, the more likely it is to develop, but there's triggers that greatly increase the risk of someone getting it, and that includes your family members. We now, for years, many of us have been advocating that family members should do certain things to decrease their risk, but now we have medical science showing that we're correct. I'll start off by a few years ago, the OMRF in Oklahoma City, they did a study where they looked at all the family members of their lupus patients, followed them over 6 years, and they showed that those who had less than 7 hours of sleep on average each night had a threefold increased risk of developing lupus, systemic lupus, over that 6 years. And we know that lack of sleep is one of the triggers for causing lupus. Then more recently, just last year, Harvard came out with a study called the VITAL study, where they looked at a huge database of people across the United States, and they followed them over a very long amount of time. And they asked the question, does vitamin D or does omega-3 fatty acid supplements decrease the risk of autoimmune diseases? What they showed is the following. People who were taking vitamin D regularly had a 39% less risk of developing an autoimmune disease. People who had a family member who also has an autoimmune disease that were taking an omega-3 fatty acid supplement had a 33% reduced risk. So those are a few of the triggers that you can tell your family members to do to decrease the risk. But other things, perfect dental care. We know that periodontitis and poor dental care increases the risk because the bad bacteria interacts with the immune system. Smoking cigarettes, huge cause of autoimmune diseases like lupus. And then, of course, strict ultraviolet sun protection as well are important. There's a long list, and Kelly's going to share with you a link to my article that has the full list that's available. Number 2.
Oh, 1 second, Dr. T. Just so everyone knows that the tips are in the comments section, and they are there along with the links that you can go back if you want more information on each tip. Dr. Thomas has his blogs on his website with more information for each tip. And I'll save my questions too for later.
Great.
Number 2, T.
Tip number 2. The vast majority of lupus patients can have a successful pregnancy. Very different than 20 years ago, where we used to tell most of our patients not to get pregnant. Just today, I saw one of my patients with central nervous system lupus, severe lupus, and she successfully just had a baby boy. He's just beautiful. I kept her on Safnello through the middle of her pregnancy. I had her on azathioprine throughout her pregnancy, IVIG throughout her pregnancy because she has dysautonomia, hydroxychloroquine and aspirin, and she just did amazing. Proper planning is the key. And so Kelly will also include a link to my recommendations on how to have a successful pregnancy. And I'm batting close to 100% with my patients. So it's definitely doable and a reality. Number 3, 20% of the time, people who are well controlled with their lupus, your anti-nuclear antibody becomes negative. Why is that important? Let's say that your insurance changes, or you move, or you have to get another rheumatologist, or your rheumatologist retires. So many of us are retiring. You go see someone else, they do your labs. You look like you don't have lupus. You're at risk of them stopping your medications. So the number 3 is to keep records of everything, every lab, every doctor's note, every test that you do, every biopsy, and keep a permanent file. Don't think that those are going to be automatically available for other doctors, because that's absolutely not true. 3 examples. I've had patients go to other rheumatologists because of these different reasons, and all 3 of them, their ANAs were negative because they were in remission on therapy. One of them had a flare-up of her interstitial lung disease because her doctor didn't believe she had lupus. Another one had a horrible stroke because of something called TTP, because she went to a major medical center and they didn't think she had lupus either because she was doing so good and her labs were negative. And then the most recent patient I saw, she saw a rheumatologist that told her that I was just trying to find something wrong with her. He stopped her medicines. She had a horrible flare, went to Johns Hopkins, and now she has severe pulmonary hypertension that requires oxygen. So protect yourself, keep all records. By the way, do it every time you see the doctor. Say, can I have a copy of my last labs and the last note? You probably won't be charged anything if you do it that way. Fact number 4, ask your doctor to order a lipoprotein A level. Lipoprotein A. Cardiovascular Heart attacks and strokes are the number one cause of death in our patients. They happen 10 to 20 years earlier than they should, but most of them are preventable by doing the right things as far as strict blood pressure, cholesterol, diabetes control, and controlling the lupus itself. But lipoprotein A, high levels, it's a bad type of cholesterol, has been shown to increase that risk. And now several organizations recommend that high-risk patients have it checked. Most doctors don't know this, by the way, so bring it up to your doctor and just let them know that the American Heart Association now recommends it. The European Society of Cardiology recommends it. And I heard this from the chief of the rheumatology cardiology combined clinic at Harvard, and she recommended checking it. So I do that on all my patients. If the level is greater than 180, it's recommended to treat it with either a monoclonal antibody or with niacin. Fact number 5, eat a healthy anti-inflammatory diet. There's more and more evidence that this is beneficial for the immune system. We know that the American diet, which is oftentimes called the SAD diet, which stands for Standard American Diet, actually increases the risk of autoimmune diseases. So a plant-based diet, a diet that's low in processed foods. Processed foods are things like chips, snacks, sweets, even bread. The bread that has all those chemicals that you can smell the chemicals when you eat it. You want good fresh bread that's actually baked correctly. Lunch meat, ice cream. Learn to eat a good healthy diet, food that you actually cook yourself. One that's high in omega-3 fatty acids. Walnuts are very high. Cold water fishes are very high. Try to get at least a couple of servings per week. Also, something called resistant starches. Resistant starches is a prebiotic. It's the food or the bacteria probiotic. I'll tell you a secret that I do. I do intermittent fasting every day. I lost 40 pounds and I'm keeping it off. And I break my fast with something very easy that's a probiotic and prebiotic. I buy the short Siggy's yogurts. They're fruit flavored. They're delicious. They're high in fat, so they fill you up. And then I put some walnuts in it and some oatmeal directly from the box, mix it together. And I have my resistant starches. I have the omega-3s from the walnuts. And then I have those bacteria alive probiotics from the yogurt. Great way to break my fast. Very easy to fit that into your diet. Fact number 6. Always carry around an up-to-date medication list that includes your drug intolerances. Protect yourself. I recently underwent emergency surgery. I had the abrupt onset of severe belly pain. I mean, the most horrible pain I've ever felt. And my gallbladder actually necrosed, and I had to have emergency surgery. Luckily, I was carrying my medication list with me. I'm just in the habit of doing that. So they knew exactly what I was on. But this is a common scenario. A patient of mine will get a urinary tract infection. They'll end up in the urgent care center or ER. You can't remember everything, especially when you're sick. And if you have that medication list that says that you're allergic to sulfa antibiotics, you always want to include that you're allergic to sulfa antibiotics because it can flare up lupus. Then the doctors won't give it to you because the drug of choice for urinary tract infections is a sulfa antibiotic. And I have patients who flare up with their lupus because they're given it to them and they just couldn't remember to tell the doctors that when they were there. So protect yourself with a medication list and allergy list that includes sulfa antibiotics. Have a home blood pressure machine. The American College of Cardiology now recommends that we go by home blood pressure results instead of what we get into the office because they're more accurate. One scenario that everybody knows about is white coat hypertension. White coat hypertension might look falsely elevated in our office, and then you can show a more accurate one at home, and then you're not inadvertently given more medicine than you should. But another one that many people haven't heard about is something called masked hypertension, where the high blood pressure is masked. It looks normal in the doctor's office, but it's high at the patient's home when they check it, and that needs treated because that increases the risk of heart attacks and strokes. So do your own blood pressures. Do like 3 in a row before all doctor visits, write them down, and then hand give it to the doctor when you see them, and they'll appreciate that, and you'll get better care. Fact number 8, infections are the second most common cause of death in lupus patients. Most of them are preventable by vaccinations. You'll rarely meet a doctor that doesn't get every single vaccine, because we rarely see major problems or severe side effects from vaccines, but we see people die from infections all the time. I mean, it's just really sad when that happens. So get your RSV vaccine. If you're immunosuppressed, it's recommended for people over the age of 19. Respiratory syncytial viral infection vaccine. Get it from your pharmacy. Your doctor won't give it to you, but your pharmacist can. Shingrix for immunosuppressed patients over the age of 19. Again, that's for shingles. Get it at your pharmacy. Hepatitis B is now recommended. A new recommendation for pneumonia shots is everyone over 19 who's immunosuppressed should get a Prevnar 20 pneumonia shot. So it's a third pneumonia shot. Most of you have probably had Prevnar 13 and the Pneumovax. Now you need a Prevnar 20 if it's been more than 5 years since your Pneumovax. And then a new thing about COVID-19 vaccines. They're going to change the COVID-19 vaccine every fall, just like we do the flu shot, to go against the most prevalent strain. The CDC, they recommend that immunosuppressed patients and people over the age of 16 get a COVID vaccine in the fall with their flu shot. Then 2 months later, go ahead and get the booster shot. So you need 2 COVID-19 shots now every fall. And then lastly, with vaccines, people with systemic lupus, they get human papilloma viral infections, HPV, more often than the general population, probably because of their abnormal immune systems. And they have a higher prevalence of HPV-associated cancers, cervical cancer, throat cancer, even skin cancers as well. My next door neighbor, I can see his house right there. He's actually dead, unfortunately, because he developed HPV associated cancer. One of my very best friends, she developed anal cancer from HPV. I wish my generation had the chance to get the Gardasil. So please get Gardasil if you're under the age of 45. Make sure your children 9 years of age and older get it. That's a gift you can give them to decrease their risk of cancer. Number 9, vitamin D is an important treatment for lupus. I'm always shocked at how many of my patients are non-compliant with taking their vitamin D. It shocks me. It's one of the safest treatments we have. Just to give you 3 studies, Dr. Michelle Petrie at Johns Hopkins, she did a study showing that she took all of her patients, over 1,000, tested their vitamin D. Those who were low, she put on weekly vitamin D plus a daily vitamin D over-the-counter supplement. Then she showed that those who had an increase of 20 or higher over their baseline that went to at least 40, that they had significantly improved disease activity simply by taking vitamin D. Another study, a pediatric lupus study, our children get the worst, most severe lupus. They gave half of the patients weekly vitamin D, the other half placebo, and saw significantly improved disease activity in the ones with vitamin D simply by taking vitamin D. A Spanish study, they looked at skin lupus, cutaneous lupus. They had half the patients take a daily over-the-counter vitamin D, compared it to placebo. That's the only change they made. A year later, there was significant improvements in the skin lupus or cutaneous lupus in the vitamin D group. So to have your vitamin D checked regularly, ask what the number is. If it's not close to 40, then ask for a vitamin D supplement and aim for a level of around 40. Now we're coming to the final one, Kelli. Then we'll be open for questions and answers, Q&A. Number 10. This is one of the most important. Please listen. Ask your doctor to check a whole blood hydroxychloroquine drug level every visit. I have found this to be one of the most helpful things I've done in my entire clinic. Most of my patients are in remission or low disease activity, and very few are on steroids. And this is part of the reason. Our goal is we want to get a level of 750 to 1200. We know that if it's at a level of 750 to 1200, there's significantly less flares, less disease activity, less hospitalizations, and less eye problems from hydroxychloroquine as well. Just this past week, I have two great illustrations. I saw an 18-year-old woman with severe lupus nephritis, and a few months ago, her urine protein level jumped up to 1200. It should be less than 200, and it was previously normal. Her level was only 89. She was not taking her medication. So I scared the crap out of her. She started taking it. The next level, her urine protein was normal just simply from taking her medication regularly. Another patient of mine, severe lupus nephritis, she almost went into complete kidney failure, failed cyclophosphamide mycophenolate. Now she's doing amazing on Benlysta plus lupkynis as combination therapy. Her proteinuria jumped up way above 2,000, and I checked her labs, and she was not taking her hydroxychloroquine regularly. And I showed her on her labs. She's had this happen several times over the past couple of years, and every time she flared, it was related to not taking her hydroxychloroquine. It's one of the safest drugs we have, and it's just phenomenal at how good it works when people actually take it. So happy World Lupus Day. I hope I can help people, and I'm open to answer any questions.
Oh, yes. There's been some questions that have come in, and just want to remind everyone, you'll see each of Dr. T's 10 tips on May 10th are in the comments, along with links to more information on his website, lupusencyclopedia.com. And as always, Dr. T, your blogs are so informative, and there's so many great tips and research, and everything is very accessible for us patients, so we're so thankful. Okay, this is a question for me. This is really fascinating. Going back to tip 1, how family members can reduce their chances for developing an autoimmune disease. Now, as we know, lupus is the combination of genetic predisposition and environmental triggers. So are you saying that in the same family, we have the same DNA, essentially, some of the same genetic variances, but you can sidestep the lupus landmine, if you want to call it, by taking vitamin D, omega-3, getting good sleep hygiene, and protecting yourself from, I mean, this is amazing. This is amazing.
Yep. And it doesn't totally prevent it, just to let everybody know, like, you can have an automobile and be great with your oil changes, your perfect maintenance, right, and still it can break down, but you're much less likely to have it break down if you do those things compared to someone who's lazy and doesn't do those things. Same thing with these. It doesn't prevent lupus in everyone, but so far a couple of studies show it decreases the risks significantly. So that is something special, and so you really want to give this list to all your family members.
Yes. I mean, you're absolutely right. You can't prevent getting a virus. Like with me, I got Epstein-Barr virus. But one day, maybe they'll have a vaccine for that.
Wouldn't that be wonderful?
Would be amazing.
That would be one of the biggest ways to reduce it, because you're right, Kelly. We can't prevent Epstein-Barr virus. It's a huge trigger for systemic lupus. Some of you watching this, just like Kelly, developed your lupus after getting Epstein-Barr virus. We hear that all the time.
Yes. Okay. So here is a question about CAR T. What's the difference between CAR T and CAR NK therapy for lupus, and is there a better option in your opinion?
Yes, thanks for asking that, because I was actually waffling on whether to have CAR T as my final 10. So you actually added my 10th fact. At this point, there's a therapy called CAR T cell therapy. And at this point, there's been 43 people with severe systemic lupus, most of them with severe lupus nephritis, who failed the standard therapies. Nothing was left, and all 43 were treated with this CAR T cell therapy. The vast majority, in fact, close to all of them, went into complete drug-free remission. Think of that, in total remission and not taking hydroxychloroquine or steroids or mycophenolate mofetil. Two of them have been in remission for close to 4 years. This is a new chapter in the treatment of lupus. I hope it ends up being as wonderful as it sounds so far, because we've never, ever had a treatment that cured people for this long and got them off of medicines. No treatment, no clinical trial whatsoever. And now there's a lot of clinical trials being started. So what is CAR T cell therapy? We take the T cells, which is a type of white blood cell, out of the patient. Then the patients are treated with something to get rid of all of their white blood cells, or most of them. Then they engineer those T cells to destroy the B cells of the patients. Now, the B cells are those cells, those white blood cells that make all those horrible antibodies that attack your body, like if your anti-nuclear antibody or anti-double-stranded DNA. So the T cells are put back. Those are the CAR T cells, stands for chimeric antigen receptor T cells. And then they destroy all of the B cells, those bad B cells, and it resets the immune system. And that's how it essentially works. And they've seen really not a whole lot of major side effects, which is just crazy with this type of therapy so far. So, but we don't know, how safe it is in the long run. These patients need to be followed a long time. We need to have strict clinical trials. So those are underway right now. And let's cross our fingers they look as good as they sound so far. So this person asked about a different type of CAR called CAR NK, which stands for natural killer cells. That brings us to the question, every lupus patient is different. The immune system is just so incredibly complex. One patient, their B cell overactivity may be the main problem. They're the best ones to give something that's going to kill their B cells. Someone else, it might be their T cells being overactive. Someone else, it might be the antigen presenting cells like macrophages. Someone else, it might be the toll-like receptors or monocytes. Someone else, the natural killer cells. There's actually now been several CAR type of therapies that have been directed at something different other than the T cells, and they've shown very good promise. For example, up at Johns Hopkins, they did one using something called the CRISPR technique that learned how to destroy only the B cells that were producing a particular antiphospholipid antibody called beta-2 glycoprotein 1 antibody. Just think about that. What if we could design one that could just only destroy a particular type B cell that's actually causing your particular disease? The horizon is just so promising. There's so many things that can be done, and just a lot of research is going to have to be done, and it is being done at this moment.
Wow, thank you for diving into that a little bit and taking the time to give us more details. It's all so fascinating. I am in it. I am just like, tell me more. I love hearing all of this, So you talked about lupus diets, plant-based diets, also anti-inflammatory diets. You mentioned intermittent fasting, which some people know that I've been doing it since November, since I saw you at the ACR. Everyone was talking about it and how it's good to get those glucose levels down as well. So,
can I say something really quick?
Yes.
So some of you watching this have heard on the news about intermittent fasting causing heart attacks and strokes. Please ignore that. It was not a very good study. What they did is they asked a large group of people about their dietary habits, and then they looked at the ones doing intermittent fasting and compared them to another group of all the rest of the people, and there was a higher number of heart attacks in the group doing intermittent fasting. That's what's called an association study and not a causality study. Just think about it. Who's most likely to do dieting like intermittent fasting? It's overweight people who are at high risk of heart attacks and strokes. So we need a causality study, or they need to dive into the data further in that study and actually look at the percentage of people who had risk factors for heart attacks and strokes, and then compare apples to apples instead of apples to oranges.
Right. Yes, I remember you were so great about clarifying that too, because it spread quite a bit. Let's see here. We have another question. Oh, here's a question from Rebecca. Can lupus nephritis be reversed, or is it a case of taking meds to stop it getting worse?
Great question. Lupus nephritis, that's where lupus attacks the kidneys, causes inflammation, and in a high number of patients, if it's not treated aggressively and quickly, unfortunately, they go into kidney failure and need dialysis and kidney transplantation. But the trick, is if we catch it early and treat it early, the chances of remission are greatly increased. Where we run into problems are people who have a delay in diagnosis or don't take their medications or who are not treated aggressively for that. About 45% of lupus patients will develop lupus nephritis. That's why we ask you, by the way, to give us a urine sample every single time you come in, because people have no idea they have lupus nephritis until by the time they feel sick from it, they already have severe damage going on and they've had it for quite a while. We want to catch it when they have no symptoms and when it's at the curable stage. I'll just give you an example to the person who asked this question. In my clinic, I can't think of a patient who I've treated properly who has gone into kidney failure. Not one patient. I have definitely have patients who have gone into kidney failure, but each of those were patients who were non-compliant with their treatment. And it always makes me sad when that happened. Today, I just saw one of my patients who came to me with severe lupus nephritis, not controlled on the therapies that he was being given. And I went ahead and got him on therapy with Benlysta plus hydroxychloroquine plus mycophenolate, all three of those. And he is in complete remission. When I first saw him, his kidney function was way down to 40. Normally it should be around 100. So 40. I mean, he was going down towards where you could possibly go into kidney failure. Today, his kidney function is 101. 101 just simply from proper treatment. Now he certainly has permanent damage to his kidneys, and he needs to learn how to prevent it from getting worse. Number one, by keeping the lupus nephritis under control with medicines. It requires the medicines, but also doing things to prevent the kidney damage from getting worse, like strict blood pressure control, cholesterol control, eating a vegetable-based, plant-based diet. By the way, it sounds like someone here does have lupus nephritis. There's probably some more of you. If you have lupus nephritis, you probably have something called chronic kidney disease. You probably have some damage to your kidneys. You can help prevent it from getting worse. Just go to my website, lupusencyclopedia.com, type in chronic kidney disease, and I put in a blog post, 3 strategies for preventing chronic kidney disease from getting worse. And it's a list of practical advice on things you can do to decrease your risk of getting worse over time. So I'm glad you asked that question, and I hope that you go to my blog post and read that article and put it into practice.
Yeah. Read more on his website, because it sounds like in some cases, yes, it can be reversed, and in some cases, there will be permanent damage.
Yep.
But there are things you can do to stop things from progressing, mainly complying with your treatment protocols.
Oh, and let me add to that, Kelly. This is actually a good point, because this goes with everything that lupus does. There's 2 stages to lupus causing problems. There's the inflammatory stage where the white blood cells are attacking the organ. Like let's say, for example, let's say you get a burn, or let's say you get poison ivy on your skin and it's very itchy and red and painful. That's the inflammatory stage. Or you get a bad cut and it's healing up and it's red and itchy and everything. And then there's the damaged permanent scar stage where the organ is permanently damaged and will never ever get better. We want to catch things in the inflammatory stage where things are reversible. And so that's where the lupus nephritis part, when it's early, we can reverse that part absolutely and keep it from causing permanent damage. But by the time there is some permanent damage, we can't reverse that, and it's there forever. But you want to do everything you can to keep the inflammation under control, and that's for every single lupus problem.
Oh, so Gloria has a question. Are LED lights harmful to lupus patients?
The answer is most likely no, and that's also a good question. We know from a study, I think it was around 2010, where they showed that incandescent light bulbs and fluorescent light bulbs give off ultraviolet light, and it's not a lot like the sun, but just think about it. You're constantly bombarded with these low levels of ultraviolet light. The UV light goes and damages the skin, are the cells underneath the skin. That's why most of us, like me, wrinkle or get skin cancer. That actually adds to it, but also lupus, it does it, because then the cells, they release their internal contents like nuclear antigens, and then your anti-nuclear antibodies, your anti-nuclear DNA antibodies thinks that it's a danger and a foreign invader, and then they float in around the system and lodge into the organs like the kidneys and actually cause inflammation, not just a rash at areas that are exposed to the light. That only happens in 30% of people. So incandescent and fluorescent light bulbs, change them to LED bulbs. LED bulbs are not 100% free of UV light, but it's markedly lower than the other ones. And by the way, I just learned that, by the way. I used to say LED bulbs have no UV light, which was actually the teaching, but now we're taught that they have a little tiny amount, but not very much.
Oh, I had no idea, because I was kind of curious about this question, going, no, LED lights are okay, but had no idea there is a little bit of that UV in LED lights.
And my light bulbs are LED because I get skin cancer and so does my family, and that helps protect me. Do the same in your own.
Yes. Yeah, for a lot of people don't realize when they're sitting in an office or a classroom or a library and they get a headache and they feel fuzzy and they feel tired and their joints hurt, that it's the lights that they've been sitting under for hours and hours.
And by the way, Kelly, people who work and they're in that type of situation, just remember that you have rights as someone who has lupus with the Disability Act, that your employer must protect you. And so you can get your doctor to write a note for having, for example, a filter around fluorescent lights and incandescent lights to protect you from ultraviolet light. So you do have that right. The windows as well, tinting the windows. So don't forget that you have rights as a patient.
Good reminder. Next question, Kaylee, the questions are coming in here. Is losing your voice a common reaction to a Benlysta infusion? I had no throat itchiness or trouble breathing, but sounds like she lost her voice.
Sure. So anyone who gets an infusion can get what we call an infusion reaction. Even the placebo groups in the studies even had infusion reactions as well. And a lot of times it can be an itchy rash, it can be chest pain, it can be shortness of breath, it can be hives, nausea, upset stomach pain. I mean, a huge long list of things. So I can imagine where someone could possibly get a hoarseness or something going on here if they had some type of swelling going on. I've never seen that in any of my patients, I'll have to say that, but just theoretically and medically speaking, I could see where it's not impossible. I just have to study the patient and figure out if it's truly related or not, because in lupus patients, losing your voice and getting a hoarse voice is not an uncommon problem, for example, from dry mouth, from secondary Sjogren's disease, for example. So we have to think of other possible causes as well.
Yes. That's what makes it so challenging. You have to figure out, is it the medication side effects? Is it the lupus itself? Is it another lupus overlap condition? It's quite the puzzle you're faced with every day, Dr. T.
Yep.
Never a boring day with a lupus patient, right?
Nope, you're right.
Okay, we've got Jennifer here. Jennifer says, is chest pain common in lupus patients?
I love how you can show the pictures of the people in their questions. That's great. It's nice to see the picture to the question or the person's. So, and y'all look wonderful. So chest pain is very common. There's something called serositis. The serosa is tissue that surrounds the organs, and the main ones that we have are around the heart, around the lungs, and around the abdominal contents. Lupus loves to cause inflammation of the serosa, and we call it serositis, where it can cause pleurisy.
Yes.
And it's actually the most common lung problem that we see in our lupus patients, and the most common heart problem when it causes inflammation around the lining of the heart and around the lining of the lungs. And we call it pleuritic chest pain or pleurisy. The characteristics of it is that it's painful to breathe in. And also sometimes when laying down, it can be painful to breathe in as well. So that's usually how it feels. But also we see other things as well. For example, costochondritis or inflammation or chest wall pain is a very common problem that we see as well. So that's something important to consider. Fibromyalgia pain, about 30% of our patients will have fibromyalgia, and they can have severe chest pain from tenderness and increased pain reception of the ligaments and tendons of the chest wall. And then, of course, heart attacks. We always have to worry about that. If someone gets new onset chest pain, we want them to go to the emergency room, make sure they don't have a heart attack. So it is very common. In fact, probably most lupus patients will develop chest pain because of those problems.
Yes, yes. So we have Kira, who is from the UK, joining us all the way across the pond. And here
Good
she
evening.
says, I know, right? Good, not top of the morning to you. Good evening to you. Hi, I am in UK. I failed all DMARDs. Now I'm waiting to start rituximab. I have antiphospholipid syndrome and lupus and Sjogren's, amongst other things. Do you think it's worth doing, or side effects be too bad, please? Oh, I think she's asking about the rituximab.
Sure.
Starting that.
I absolutely agree with that. In our country, and by the way, rituximab was really brought to the forefront by the United Kingdom. Dr. Eisenberg, who is just an amazing lupologist, he used it on a high percentage of his patients, and that's one of their major drugs that they use. And they've shown that most patients respond really well to it with few side effects, which is great. Here in the United States, I'm not a fan of using it first. I'd rather use Benlysta or Safnello because they're absolutely safer than rituximab overall. The reason I'm nervous about rituximab, by the way, is that it decreases the response to vaccines, and too many of our patients have very little to even no response to COVID vaccines. And of the COVID deaths that I've seen over the past 3 years, which have been devastating, I think all of them was in a rituximab patient. And so that does make me nervous about it. But if you don't have access to Benlysta or Safnello, then rituximab would be my other choice with it. But you just have to be incredibly careful with protecting yourself from infections. That's the most important thing. But it works in most people, in my experience, and in Dr. David Eisenberg's experience.
Interesting. So follow-up question. Are they still stopping rituximab before getting the COVID vaccines?
Yeah, the current recommendation, and so this is how rituximab works. It basically kills your B cells. So you get the infusion, and then your B cells drop precipitously, but you need those B cells to respond to a vaccine. And so if you get your vaccine after getting the rituximab, you're not going to have any response to it whatsoever. Over time, those B cells will slowly start to go up, and then you get your next infusion, they drop back down again. So you want to get your vaccine when those B cells are at the top part, which is right before your next rituximab. So the recommendation is to do a vaccination 2 weeks before your rituximab infusion. If you're under very good control, then we like to see if we can push the rituximab off a little bit. So let's say I have someone in remission who's been doing great for a few years, and they're on every 6 months with their rituximab. I'll try to, okay, let's see if we can go to 8 months and then give you your vaccine 2 weeks before that. So that's kind of how we juggle around the rituximab and the vaccine. 2 weeks before rituximab.
Interesting. Okay, here's the question. Is raised dsDNA only seen in lupus patients? Or can I have raised higher levels, I guess, of dsDNA due to another reason?
Yeah, and so absolutely, and us rheumatologists love to talk to each other about this problem. There's some anti-double-stranded DNAs that are much more specific for lupus. For example, there's one called Crithidia anti-double-stranded DNA, another one called FAR assay, FARR, and those are markedly increased specificity for lupus. If you're high positive for those, it's unusual to have anything else other than systemic lupus. But most anti-double-stranded DNAs are done by something called the ELISA method or the solid phase method, and we do see false positives in those. False positives meaning that it's that the person has something other than lupus. Sjogren's disease, we can absolutely see it in our Sjogren's patients. Occasionally in a healthy person that doesn't have anything else going on, infections can do it as well. Other connective tissue diseases like rheumatoid arthritis can do it as well. However, if someone has a positive anti-double-stranded DNA and doesn't have evidence for lupus or anything else, I definitely want to follow them over time because we know these antibodies can pop up many, many years before the disease does.
Interesting. I was just reading yesterday that lupus patients have such antibody-rich blood, like over 150 different types of antibodies can present in lupus patients. So we're really overachievers.
Yeah, so far they've discovered over 200 autoantibodies in systemic lupus. It's over 200 now.
Wow, it's over 200. I think I saw like it was like 180 or something like that. So that must have been an old study. Wow, that's so cool. I mean, not cool, not the right word, but interesting.
Yes, and probably it's a recent article because it's just amazing how fast technology is discovering these things. This is brand new.
Oh, this is fun. Nancy says she loved the photo of you and your cat.
Thank you.
I mentioned that earlier too.
You want to see my cat? You want me to grab my cat real quick?
Yes, of course.
He jumped up and he gave me a big hug earlier today.
Oh, thank you, Project World Impact, raising awareness and sending love to all those affected by lupus on this important day. You're welcome. Oh, look at this cute cat.
So someone said that they loved your picture. So here's Siraway, my cat.
Yes,
He's very lovable.
Nancy has a picture of a cat too. Nancy has her cat in her photo too.
Oh yes, I love it. I love cats too. Siraway is a Savannah cat. His grandpa was a wild serval cat. That's why he's so big and spotted. But he's lovable.
It looks like a very exotic breed.
Yeah, his grandpa was a serval. He was huge.
Oh my gosh, look at this markings and the face. Oh my goodness, that's a beauty right there.
Everybody should get an animal. I tell you what, the studies show that people who own animals are healthier and live longer.
Absolutely. Oh my goodness. Thank you for sharing your kitty with us. Let's see. Oh, there's a couple good questions. I know we're running out of time and we want to do the drawing for the book, by the way. Can menopause cause more issues or mimic lupus symptoms? Oh, this is interesting. I've heard a few different things about it.
Absolutely. In fact, I have a patient who has lupus, and when she went through menopause, she was developed a whole bunch of joint pain, horrible fatigue, a lot of symptoms that was really close to her lupus. And so it was really difficult to figure out, is this her lupus or is this menopause causing it? So absolutely, you can have symptoms that mimic lupus. And we finally figured out it was her menopause, and treating her menopause took care of all the symptoms. So, you don't want to inadvertently treat that with steroids and immunosuppressants. You want to treat the menopause itself. So the answer is yes. Now, another common misconception is that in the past, we used to think that when women go through menopause, they might have better controlled disease or less disease activity. That really has not been proven to be so. So you still need to take your lupus seriously and treat it as you normally would before menopause.
What are your recommendations for dealing with persistent fatigue? And this is Shireen, her comment.
Yeah, so Shireen, we always have to figure out what the cause of the fatigue is. In lupus patients, more commonly, when we look at a large group of lupus patients, more commonly it's not due to the inflammation of lupus, it's due to something else. So we always try to look for those something else's because we have to gear the treatment towards that. For example, is the person getting a complete 8 hours of sleep at night of good quality sleep? Could they have sleep apnea? Could they have depression or anxiety disorder as the cause? Do they have a low vitamin D level that can be treated, a low vitamin B12 level that can be treated? Do they have anemia that can be
Yeah.
treated? Thyroid disease? There's a whole long list of possible things that could be going on. And by the way, it's most of the time it's inadequate sleep. So learning adequate sleep hygiene is incredibly important. Sleep hygiene meaning good lifestyle habits that help you get a good quality of sleep every night. And a lot of times we'll get a sleep study to figure out. But if lupus is the cause of the lupus inflammation is the cause of the fatigue, then we can absolutely use things to help out. Hydroxychloroquine helps a lot of our patients today. One of my patients, actually, she ran out of her hydroxychloroquine a month ago, and all at once she's incredibly fatigued and her joints are flaring out slightly. So it proved to me that her hydroxychloroquine helped a lot. Benlysta, it's amazing how many of my patients do great on Benlysta. Safnella has been shown to help out as well with fatigue from lupus. Also something called NAC, N-acetylcysteine. Mitochondrial dysfunction is a huge problem in lupus, and the mitochondria are the energy houses of the cells. And they've done some really interesting studies by giving NAC supplements to patients and saw significant improvements. It takes a high dose, like 1,800 to 2,400 milligrams per day of over-the-counter NAC to help out. If you do a Google search or go to YouTube and just put in Donald Thomas NAC fatigue, you'll find some videos that I've done about the subject on that. But don't do it without asking your doctor, because there can be some drug interactions with over-the-counter NAC supplements.
Interesting. I wrote that down. I'm going to do a little deep dive when I have a moment over the weekend. Love to hear more about NAC. Okay, Mary Jo, we're going to try and squeeze a few more questions in here. They're coming in left and right. Is a low white blood cell lymphocytes count norm?
And sorry,
well, norm.
my other dog had to get up to go to the bathroom.
Oh.
This is Musette. Say hi to everybody, Musette.
Oh my goodness. Look at that little outfit too. That's so
yeah,
cute.
she licks herself from allergies. So, okay. Yeah. So, if you ever look up the classification criteria for lupus, that's how we enter people into research studies for lupus, but we also oftentimes use it for diagnosis. A low lymphocyte white blood cell count is actually one of the classification criteria for all three sets of classification criteria. So it's absolutely one of the things that we see with active lupus. It can help us diagnose it, actually, and it can go lower during increased disease activity. But other things can cause it to go low as well. For example, prednisone. We give someone prednisone, the lymphocyte count can go down because of the prednisone, for example. Infections can do it as well. So we always got to figure out why it's low. But yes.
Yeah. We have someone from South Africa joining, saying thank you. Yes. Thank you for everything you're sharing.
Well, thank you to South Africa and the UK for being here. I know it's incredibly late there. So good for you for increasing your knowledge. That's kudos.
Yes, we've had quite a lot of people joining us live. This is really great. Do you need to hold Benlysta before a Prevnar 20 vaccine?
I do. Yes, I do recommend it. A couple of years ago during the COVID epidemic, a large committee was formed at the American College of Rheumatology to answer the question, what should we do with the rheumatologic drugs? They looked at all of the world's literature, and they did recommend holding Benlysta or belimumab after the COVID vaccine. And so we kind of extrapolate that to other vaccines as well. So after the Prevnar vaccine, I asked my patients to skip their next weekly dose of Benlysta and wait until the next dose after that to do their Benlysta. If they're getting infusions of Benlysta, which is every 4 weeks, then we like to time it exactly in the middle. So 2 weeks after the previous infusion and 2 weeks before the next infusion.
What about methotrexate? No holds anymore on that one?
Methotrexate, we try to stop it for 2 weeks if we can get away with it, because it increases the response rate. However, some people will flare up when we do that. And so there's a lot of patients who will only hold it for 1 week. Holding it for 2 weeks, the vaccine works much, much better. But holding it for 1 week, they did a study showing that still the vast majority of patients responded well to it and did not flare up as much as holding it for 2 weeks. So 1 or 2 weeks. And by the way, it's only after the vaccine, not before the vaccine. So example, if Kelly took her methotrexate this morning and I gave her a vaccine, that's perfectly fine. I would just say, Kelly, please stop your next week or two of methotrexate, depending upon what her risk of flaring is.
Oh my goodness. Thank you so much for that information. There's been so many wonderful pearls of wisdom in this chat on World Lupus Day. We have a lot of comments too that are coming in, questions that are coming in. We have, let's see here. Here's a good one. I'm trying to kind of wrap it up because I want to get to the giveaway. This person is asking, do you prefer Benlysta IV or sub-Q? The question of the ages. I know that people go back and forth.
Yeah, well, there is instances where we absolutely 100% prefer the IV form, and that's in the poorly adherent patient. That patient, I will always want them to get the IV form because I don't know if they're doing their treatments, and then they come in and they tell me they're taking their medicine, and who knows if they really are. And then the wrong thing to do is to adjust their medicine. They're just not taking their Benlysta. So that's the main time. So otherwise, I've had patients who have done better on subcutaneous self-injections than their IV medicine. And then I've had patients who do better with their IV medicine than they do on their subcutaneous medicine. And there's no rhyme or reason to it. For example, some patients, they'll get their every 4-week IV, then they'll start to flare up a week before each infusion. So I'll put them on weekly self-injections, and they oftentimes do much better on that. And then some people, they'll do the lower dose self-injections and just not be as under control compared to getting a much higher dose once a month with the IV. So we just sometimes got to experiment back and forth.
I don't know if this is common for your patients, but this is something that I've been trying the last year is during cold and flu season is switching to sub-Q, because if I missed my window, I was missing my window in prior years during cold and flu season where I'd be getting sick and sick and sick, and then I wouldn't be able to come in for my infusion. So I missed the whole month. So now I switched to sub-Q, so at least I get something if I get sick. And then once through cold and flu season, I'll switch back to infusions.
I love that advice, Kelly. You just taught me something new. Thanks.
And if there's ever a shortage, like there was, that little hot minute where there was a shortage, you got it. You got your medicine for now.
Sure.
But I really like my infusion people. They're so fun, and I love talking to them. And it's nice to know that one and done, right? But for the cold and flu season, that's what I do. Okay, let's see here. Thank you so much for sharing this information about lupus.
Dion, good to see you, Dion. He leads a men's support group, by the way. Any men on here, men are oftentimes forgotten because, 90% of our patients are women, but men tend to get more severe disease. So Dion has a wonderful support group for men. They hold virtual support groups. So reach out and you can find just a Google, I guess, Dion Langley and men's lupus support group, or Dion, if you can put the information in the comments, that'd be wonderful because men need support.
They sure do. We had Emmett on here on Monday, and he gave his whole story and update on his dialysis and his search for his new kidney. And it's just, yes. Lupus may disproportionately impact women, but it is not a woman's disease.
Yeah.
For the last time.
Now, Dion asked a really good question. He says he's been struggling to find a good rheumatologist. And do I know when a certain rheumatologist works for me? There's something very sad going on right now. There's more rheumatologists retiring than there are rheumatologists coming into the profession. And by the year 2030, we're going to have half the number half the number of rheumatologists that we need to take care of our patients like lupus patients. And so it's a horrible problem right now. And so if you do get a good rheumatologist, hold on to that person and hope that they're a young rheumatologist that's not going to retire on you. I don't have a good answer for this. If I had bad lupus, what I would personally do is I would Google reviews, rheumatologists. I would put in my zip code, then see who's all in the area, and then I look at the reviews that people put online. Number one, don't look at the top one, because a lot of systems, they play the system. For example, at MedStar, which is Georgetown here in Washington, D.C., every doctor has 5-star ratings, and they're hundreds, but that's because they ask every patient who's doing really, really good, oh, please, can you give us a rating? What you want to do is compare all the different ratings, like vitals.com, healthmd.com. And, if you see a couple that has high ratings, but you see some that are like 2 stars, 3 stars, 1 stars, and you need to think, oh, maybe I should try a different rheumatologist. So find someone who has a lot of 4- and 5-star ratings and a bunch of different ones. That's what I would do. Unfortunately, a lot of people have to go to a major medical center that might be 30, 60 miles away, because you're more guaranteed to find someone there. So more and more people are having to travel a long distance to get a good rheumatologist.
Yeah. And I'm sure Dion knows this, and other people watching this as well, but connect with a patient group, a support group, because they often can share information about rheumatologists that they find that are really patient friendly, have good bedside manner, and then maybe some that don't. And I know that's what we do at our meetings. We just say, I need a new ophthalmologist, or I need a new nephrologist, I need a new dermatologist. And we say, oh, have you tried this person? They're great, or stay away from this person. Whatever. So connect with a patient organization. They can help guide you too in your area. Well, it is 2:01, which is 5:01 your time. And let's get to this drawing. And we have lots of people here in the Spin the Wheel. I've got this fun little app here. Have you ever used one of these, Dr. T? Super fun.
I have another one that I use. I also raffle off my books, and I have something that looks different, but they're very helpful.
Okay, so I'm going to press it and see who's going to win today. What does that say? Sweetness. Thank you.
Congratulations, Sweetness. I hope you find my book very helpful.
Yes, I'm going to send it because you are out of the country, I believe, right? Yes, I'm going to send it directly from Amazon, and hopefully there won't be any sort of issue with that. But congratulations on winning your copy of this book. Thank you, Dr. T, for those amazing 10 tips. All of them are in the comments with posts and links to your blog, lupusencyclopedia.com. Tell everybody else where they can find you if maybe they're not connected with you right now.
All right.
Dr. T, where can people find you if they're not connected with you right now?
Oh, go to lupusencyclopedia.com, and you'll get a pop-up asking for your email. Put your email in there, and then whenever I put up new blog post articles with new advice, then I'll send you an email letting you know about the new blog post that's come out. But also make sure you go there and look at my Lupus Secrets. At the top, it says Lupus Secrets. Click on it. If you do everything on my list, you're going to do so much better with your lupus. Also, click on, there's a picture of a black gentleman on there. Click on that, because it tells you what I would do if I had lupus. So those are 2 things I would highly recommend.
Awesome. Well, thank you for joining today, everyone. Happy World Lupus Day. Please come back every day to More Than Lupus and Lupus Encyclopedia Facebook pages during the entire month of May for a lot of great content for Lupus Awareness Month. And remember that lupus is a part of you, but not your whole story. You are meant to be more.
Absolutely.
Have a great one, everyone. Thank you again, Dr. T. We'll see you soon.
All right. Bye, everybody.